Now I want to thank and welcome Thompson Aderinkomi. Close. When I met him a few years ago through a friend, his passion and mission really spoke to me, and his soft-spoken and humble manner were also resonated with me. So what I'm going to do, I typically don't do this, but I'm going to read his bio because I know he's not a guy that's going to talk about himself. So I'm just going to tell you a little bit about his background. Thompson is currently the founder and CEO of RetraceHealth, a new model for primary care medicine. Governor Mark Dayton appointed Thompson to MNsure, the Minnesota Health Insurance Exchange Board of Directors, in April of 2013. In June 2014, Thompson was appointed by the Minnesota Commissioner of Health to the legislatively created All-Payer Claims Data Group to create policy to reform healthcare price transparency in Minnesota. That's a lot. In 2013, Thompson co-founded Healthcare.mn. I think there's a few members here from that. The Twin Cities' premier organization for healthcare entrepreneurs, which has grown in 2 years to over 1,000 members. From the University of Minnesota, Thompson has earned a BS in economics, an MS in statistics, and an MBA from the Carlson School of Management. So with that, I want to welcome Thompson.
Just going to set my timer here, make sure I use your time wisely. And I'm really excited that there's so many people here because, I mean, when I thought that the meetup was the main place that people signed up, and there's only 5 people that signed up. So I thought we were going to be sitting around a table, real cozy, talking about healthcare, but that's not the case. So I have the whole 40 minutes today, which is the longest I've ever been allotted to talk at a conference or at a speaking event. So what I'm going to do is I'm going to talk about RetraceHealth and where it came from and why it came into being. And then I'm going to talk about health insurance and what I think we should be doing differently around health insurance and how employers and citizens can play a role in that. So first, a story about RetraceHealth. RetraceHealth was really born out of my own and my family's need to find a better way to get primary care. I have one child, a son. His name is Enoch. He was born at the end of 2011. And by the end of 2012, he was almost 1 year old. And like a lot of 1-year-olds, he got sick quite a few times in that first year of life. And so December 2012 was no different. Again, he came down with a very aggressive cough and a fever. But this one was a little bit different than all the other ones because he didn't get better by himself in a couple weeks. And so we called the nurse line because we're very good healthcare consumers, because I've worked for health insurance companies and I know you're not supposed to go to the ER or the urgent care without talking to the nurse on a nurse line. So the nurse on a nurse line told us to go into our clinic, Fairview Pediatrics, and we went in the middle of December with a 1-year-old, and we get there and we wait in a room full of other sick people and other sick, coughing kids, which has always made me uneasy, myself personally. And I'm a self-proclaimed germaphobe. And just to really tell you how germophobic I am, my wife always complains that like I disinfect our doorknobs, like I clean our house meticulously. I was at a healthcare conference for doctors about 5 years ago, and I was in the bathroom washing my hands according to protocol, counting ABCs, 1, 2, 3s, all the bubbles were there, and this guy walks in. I didn't know who he was. This guy walks in. He just sat there watching me washing my hands, and he's like, "Wow, you're really good." And he's like, "Are you an infectious disease doc too?" Because I am, and that's how I wash my hands. And so I really took that as a major compliment. So I really don't like being at the clinic, with other sick people, but there we are. We're in the waiting room. We go in the back, as usual, and they make us sit in the sterile exam room now after sitting in the waiting room. And then the nurse comes in, makes my kid take off all his clothes, puts him on the cold metal tray for weighing him. He's practically limp. I mean, he has a fever of over 100 degrees Fahrenheit. He's coughing severely. And all of that, we finally get to see the doctor. They put the cold stethoscope on his naked body, and, oh, it's a virus. You just go home, and it'll resolve itself in a couple days. And that was infuriating. As a parent, and my wife was there as well. So a couple days go by, and nothing changes. In fact, the fever persists, the cough persists, gets worse. We're all losing sleep, and we go to the clinic again at the prompting of the nurse on the nurse line. An exact same episode happens resulting in us being sent home, being told it's actually still a virus, and it'll get better. It doesn't get better. So it happens a third time. The nurse on the nurse line tells us to go in. So by this time, we think our kid has some type of disease or he's dying. We're Googling things. And with some cursory research, my wife and I determined that he has pneumonia, and that he needs to be given an antibiotic. And I know there are all the controversy around antibiotics, so on and so forth. But that's what we determined with some cursory Google searching. And so we go in a fourth time, and this time there's a student there with the doctor. And it's been a different doctor every single time. So this fourth time it was actually our pediatrician that has been with him from birth. And she has a student there who's on her rounds, training, whatever they do, before they kind of get thrown into the wild as doctors. And the student puts the stethoscope on his chest for literally I think it was 2 seconds. And she's like, it's pneumonia. And they diagnosed him, and they wrote the antibiotic. And so this fourth visit, within 24 hours, my son is better. He's recovered, he's healthy, he just turned 5 a couple of weeks ago. But to add insult to injury, my wife and I were on a high deductible plan because I was working on another startup at the time. So we bought our health insurance in the individual market. And at the time, our deductible was $7,000, which is low today, right? So at that time, it was $7,000. So we get a bill in the mail for all 4 visits. And the total bill was $664.28. $664.28. I'm not making that number up for all those visits. And I was just, we were both speechless. We're happy our kid was healthy, right? But $664 for probably what was 10 hours wasted of my time and my wife's time. So now you're at 20 hours, and you're sending us this bill. The antibiotic was only $4. So it wasn't the drug, that drove the price of the claim up. So we're sitting there, and my wife and I were like, well, what would happen if we were like a dual income household, and we both were working 2 jobs, hourly pay, and so every time we were taking off, we were losing income on top of having to pay, for the visits because we're on a high deductible plan. What if we didn't have transportation and we're taking a bus every single time? So you're paying for transportation, you're waiting at the bus stop. This is December 2012. It was very cold and snowy, not like this winter, this year. What if we didn't have transportation? So all these thoughts are running through our head about what about all these people out there that do not have the resources that we have? How would they have dealt with this situation where their child had just gone undiagnosed? What if they never went back for the second visit or the third visit? So the pneumonia would have persisted until they ended up in the ER with some irreversible damage done to their only child. So it was this experience that caused me to start Retrace Health. It wasn't really this grandiose vision for changing the healthcare system. That came later and has always been a part of me. But really, it was simply because we wanted to take our kid to a different clinic. So I started doing research, looking for a different clinic in Minnesota, in the Twin Cities, and we couldn't find one. I couldn't find a single clinic that I thought was doing healthcare correctly. So then I expanded my search using my freshly minted MBA skills at the time. And I was like, okay, I'll just do some research and find out what's going on, and maybe I can find a doctor or something to partner with in the Twin Cities, and we can start this new type of medical practice mimicking this new model that we'll find in San Francisco or something like that. And I still couldn't find a model that fit and that was doing economically and from an experience standpoint what I thought a clinic should do to solve the problem that my wife and I experienced. So you guys kind of get the long version of the Retrace Health story. So this part I'm going to tell you now, I usually skip over. Because usually I skip from this epiphany to bam, we started Retrace Health. But what actually happened in between was I was consulting. I just finished my MBA, and I was trying to get this thing started. And I found, at least for myself, when you're consulting and making a lot of money for not doing a lot of work, there's not that much fire, to really get your company off the ground. So one weekend, we went to New York to visit some friends, and when I was in New York, everybody was hustling. Everybody was just working, working, trying to change the world. And it just made me feel really embarrassed, because I'd been thinking about this business for 3-4 months and hadn't really taken any action. So I finally took some action, and we found a clinic to partner with. And the initial idea was, okay, you're a clinic, you have the doctors, you have all that stuff, so we'll partner with you, and we'll take care of all the other stuff, the marketing, the technology, the logistics, to make primary care medicine work better. And we worked on this with this clinic, this large independent clinic, about 30 doctors, and the deal fell apart like 2 days before launch. Like we worked on it for 3 months, and then it was just very clear that our objectives were different. Because, and I should have realized this, but I think I was just kept on telling myself that it was going to work anyways. But oftentimes in conversations, the conversation would go like this: me, how can we get the price lower? Like, can we just get that price a little bit lower? Them, we need to get this price a little bit higher, to cover our fixed costs. How can we? Do you think that how elastic do you think the demand is for primary care services? Can we increase the price? So this kept on coming up over and over again, and finally we're at a coffee shop, and it just all fell apart because the two missions, the two objectives are just too different. So at first I thought that was a failure of RetraceHealth, but I had some very good mentors mentoring me at the time. They encouraged me to keep on going, and to just start it themselves. One of my mentors, he said, being a doctor isn't that hard. He was a doctor. And starting a clinic is not that hard either. You can do it. You're pretty smart. And I was like, really? Like, you think so? And he said, yeah, just try. So I did. So we tried. So that's how we got to the version of RetraceHealth that we have today, where we're not just the technology, we're not just the brand, we're not just the marketing, but we're also the actual medical providers, where we employ all of our medical providers. One thing that happened along this RetraceHealth journey, I was talking to one of my current board members, Linda Hall. She's a former CEO of MinuteClinic, and I gave her my business plan. I remember we met at Caribou off of 394. It's the first time I've ever met her. And I emailed her the business plan a couple days before, and I walked into Caribou, and she's sitting there, and it's all marked up, and she says, I hate it. I hate this thing. I was like, oh, wow, like you hate my business plan? And she said, you got to get rid of the physical clinics. She said, I did the MinuteClinic thing. She took it from 2 clinics to 80 clinics. It's too capital intensive. And she told me about all the mistakes they made and how much money they had to raise and all the corrections that they had to make and how expensive it was. And she said, just get rid of the clinics, and I think it'll work. And I didn't really know how to get rid of the clinics at that time, but I started thinking back to my personal experience working at my parents' company. My parents own and operate a home health care agency for the homebound and the elderly. And I worked there out of high school. And so all my life I've seen people going out into the home, and somehow, for some reason, it just kind of clicked. And I realized that we could put the two things together. We can take a primary care clinic and operate it in a similar fashion to the way my parents operate their home care clinic, except use a bunch of technology. Like a whole bunch of technology to streamline the processes, push as much care to the virtual setting as possible. By virtual, I mean online care. And so that's where we are today with RetraceHealth. If I describe RetraceHealth, what we do for people is we save them time. Like that's our core thing that we do. We save people a ton of time. Doesn't matter if you're a busy professional, doesn't matter if you're a stay-at-home parent, doesn't matter if you're a dual income household, doesn't matter if you're a single male that's never been to the doctor before. We save you time because we bring all the care to you. Every visit starts with a video visit online. And if necessary, we deploy someone to your home that same day to do x-rays, blood draws, physical exams, vaccinations. Literally anything that can be done in a primary care clinic, we do in the patient's home, or we do via online video. Unlike a regular clinic, you can come to our website and you can see all of our providers, and you can see their live schedule. I mean, while you're watching it, you might actually see like time blocks disappear. And you can pick the time block that you want to have your video visit. Unlike a regular clinic, there's no time limit on your visit. We schedule 30 minutes, and it's an actual 30 minutes. How many people here have recently got a massage at a professional massage place? You know how like when you pay for the hour massage, but then there's like 20 minutes of setup and tear down, and they're like talking to you, and your massage is really like 30, 40 minutes. And that's really annoying to me. We decided not to do that. You actually get the 30 minutes. We do all of our prep beforehand, and all of our providers have time allotted to do post-visit prep, post-visit work after the visit, so you actually get that 30 minutes. And if you can't finish your visit in 30 minutes, we'll reschedule a follow-up visit in a couple hours at no additional charge. You know how when you go to the clinic and they charge you by the number of complaints that you have? Or if you have 3 kids and one gave the other 2 strep, they're going to charge you for all 3 of the kids, even though there's actually really no incremental cost to providing that service. Well, for us, we charge per time slot. because I decided I want to get rid of everything that's annoying to me as a consumer in the primary care setting and see if people are willing to pay. So for us, many of our patients love the service so much because in that 30-minute time slot, we were often treating 2 or 3 people. Or if we come to your home, we schedule our home visits for an hour. Many times, we're treating the entire family. Sometimes it's for the same thing, sometimes it's for different stuff. And we're taking a really long view in that if we can capture people for life, they'll become lifetime patients of RetraceHealth. And I'm not trying to maximize how much value I can accrue onto the company on a transactional level. I want to accrue that value over that person's entire lifetime, and I want to become their de facto place to come to for any medical concern that they might have, and who knows what other services we might put on top of it. So that's how RetraceHealth works today. That's how it came into being. And today, let me just check the time here. Today, we have 5 medical providers. We're currently hiring for more. Our team is about 12 people strong. We office out of downtown Minneapolis in a co-working space. And we have some great partners, some great investors. So for starters, I'll start with the investing side. So I bootstrapped RetraceHealth for the first 2 years. It was a very, very painful process that I would not recommend to anyone to bootstrap their company, but I wouldn't change it looking back, but I also wouldn't recommend it for people to do it because, I mean, if I just want to be really honest and real, which I think makes these kind of talks more interesting, like the lowest point that I had as a founder of RetraceHealth was probably about a year ago, and there was no money in my personal checking account, which is joint with my wife, so she didn't have like a secret stash somewhere. You know, we had already drained our 401k and savings and our HSA account and all that kind of stuff to make the company work. The business checking account was negative, you know, at Wells Fargo. All of our credit cards were maxed out, and our son was wearing his last diaper. Like, for me, that was the ultimate lowest point for me because I knew I literally had no money. And I already borrowed money from my parents and my siblings at this time, you know, to make all this work. I literally had no money. He's wearing his last diaper. Like, what the heck are we going to do? You know, and I'm not a crier, but if I was, like, I probably would have cried at that point. I couldn't even tell my wife, you know, that we can't go to Target tomorrow, you know, to buy these diapers. And, I mean, fortunately for us, a check came in the mail, like, the next day from some vendor that hadn't paid me. You know, they were late, so we were able to cash a check and buy the diapers and all that kind of stuff. So the story ended out well, but that's kind of the journey that we're going through here because the healthcare industry is so resistant to change. You know, so resistant. Things take way longer than they should. Things that should happen don't happen, and things that shouldn't happen with the greatest of ease, like someone sprayed WD-40 all over it. I mean, that's the way the healthcare system works today, and that is what has shaped RetraceHealth and the type of people that we've attracted to our company. It's people that want to not only help people achieve the highest levels of health, not only people who want to retrace our steps back through time to where healthcare actually made sense, you know, but it's people that want to leave a lasting impression on the healthcare system. So I'm really excited to work with the people that I work with every day, and that's how I know we're going to succeed. And that's why I think investors have invested in us. So in a couple days, there'll be some press releases and stuff that come out. Sorry, when's this video going to be released? Is it going to be like online, like right away? Okay, all right. So when do you want it to be released? It just can't be before the press releases, so which are next week. So our first investors were Health East Care System, and I met their CEO, Catherine, at that group that I was appointed to by the legislature. And the only reason I ever talked to her, probably, I don't know if she remembers, is we were both late to one of these monthly meetings. And so we arrived at the same time, and I held the door open for her. And then we were talking, because it was quite a long walk through the building to get to the actual meeting room for the legislative work group. And we were talking, and we kind of hit it off really well, and we seemed to be getting along. So that day, I sat next to her during the work group, you know, which I wouldn't have done because I just had my seat and I sat there. You know, so I sat next to her, and we were talking And we had coffee like a week later, and she really liked the concept of Retrace Health. She said she liked me personally and thought, I was doing good things. And then I threw out this idea of partnering with Health East's care system as a partner, like not a customer, not a vendor, just as a partner to help us work through some stuff that I thought that we needed to work through at the time. So I had a meeting with her and their entire executive team, like their weekly executive roundtable. So all the executives are there, and I'm talking to all the executives, explaining to them what I think that we should do. And their CFO was in the back, and he looked like he was scowling at me the whole time, but apparently he wasn't, because towards the end of the meeting, he was like, well, why wouldn't I just invest in your company, now, and also do all that other stuff that you're talking about? So, because I might as well get the upside, if I'm going to take on this risk. And I was like, that sounds like a good idea to me, and I mean, that's what I would do, so I mean, it's been great working with Health East. I mean, so I think that 3 months later, probably no more than 3 meetings later, I mean, they invested a lot of money into Retrace Health. So that really kind of helped bump us and helped give us a lot of the stability that we needed to focus on growth. And then over the last 2 years, I had gotten acquainted with McKesson Ventures, which is a venture arm of McKesson Corporation. And they had me speak at one of their conferences in the summer of 2013. And that's how I got to know them. And so I just developed this relationship with them, and I was talking to them, and one day I was talking to Aaron, one of the partners there, and he said, I mean, you guys are really early. We don't do things this early, but maybe we should do it anyways. And I was like, that also sounds good to me. So they invested, and then once they said that, I called Blue Cross Blue Shield of Minnesota, who had been thinking about investing in us, and I said, look, like there's this much left. I know we're already talking, we've already done all the talks. Do you want to do it now? And they said yes, since, it was pretty easy. The diligence had been done. There's not that much work to do. So a lot of people, especially healthcare entrepreneurs, they ask, well, how did you raise all this money from these strategics and these corporate investors? And I'm like, I didn't actually raise money. Like, I didn't do the whole go out and pitch with the deck and, schmooze with investor type of thing. I just had a lot of blessings and good things accrue to me, maybe just by virtue of being in the right place at the right time. But I didn't, actually go and get money. So I can't give advice to people in that sense. But it worked. These guys have been great. They're very supportive. The CFO of Health East is on our board. Linda Hall, the former CEO of MinuteClinic, is on our board, as well as Kyle Rolfing, who a lot of you might know as one of the founders of Definity Health and Red Brick Health. So that's the Retrace Health funding story. So, but what about customers? What about revenue? As one of the co-founders of Healthcare.mn, a lot of people want to help healthcare entrepreneurs, and I always ask them, that there's 3 C's of entrepreneurship: cash, customers, and cake. As an entrepreneur, you should just have something that you like, and for me, it's cake, but I think that every entrepreneur should just focus on those 2 things, cash and customers, and if someone can't help you get one of those 2 things, you're probably wasting your time. I know I wasted a lot of my time on my first 2 startups, and even on Retrace Health, focusing on things that weren't either directly related to getting more customers or directly related to getting cash in the business banking account so that I could get more customers. And when it comes to customers for us, we had this long circuitous path to figuring out exactly what we were supposed to be doing. When I finally knuckled down and quit the consulting, I quit cold turkey the consulting, because I knew if I didn't, that I would constantly be distracted by working for these clients and making money and billing and all this stuff. But I needed to devote all my time to the startup. So I quit cold turkey consulting, and then I started telling people that, look, I'm going to start this really cool company in about 3 to 6 months. I'll give you the opportunity to give me $300 a person, and I'll give you lifetime access to my company when I start it. But the deal is you have to give it to me now. And I had heard rumors of how the founder of Lifetime had actually started his company that way. And I think that's why it's called Lifetime Fitness. I might be wrong, but I think that's actually why it's called Lifetime Fitness, is he started off selling these lifetime memberships, to this new way of doing health and wellness. So I thought, okay, I'll do the same thing. Kind of my own Kickstarter campaign, because Kickstarter had rejected our campaign, as well. So we didn't really have a choice. And so we got 30 families to give us $300 a person for each person in their family. So it was about 45, 50 people that gave us this money, like about 4 months before we launched. I mean, nothing more than a website page describing what we were going to do. So these were our first patients, and it wasn't about the money. It was really about having patients to practice on. So these people gave us a lot of their time, a lot of feedback, about our processes, our experience, letting us practice coming out to their home, doing video visits, testing our software, all this kind of stuff. So I thought that we could grow the company by selling directly to individuals. Just going to individuals and say, look, buy this membership, very similar to a gym membership, very similarly priced, and you'll have unlimited access to primary care services, all in the comfort of your home, with an experience that rivals some of the best services you most likely consume as a consumer. And we failed miserably. I mean, we got a couple people to sign up, but people just weren't getting it. People would say, so is this insurance? Do I need insurance and this membership? And no, it's not insurance. It's a clinic, but it's a membership. And people were very confused. The ACA was really picking up steam at this time, so there's a lot of confusion and noise in the marketplace. So eventually we had to abandon the direct-to-consumer model of selling these memberships. We tried introducing pay per visit, fee for service, and it still didn't work because people would just be like, well, I want to pay with my Blue Cross card. I want to pay with my Medica card or my Health Partners card. So we finally switched, after 6 months affiliate, we switched to selling to employers. So I figured, okay, we'll go to self-insured employers who are on the hook for the dollars. Clearly, we're saving them money because our unit costs are lower. Our unit price, that we charge an employer is lower than ER, urgent care, and certainly most regular clinics. On top of that, we increase productivity because instead of people taking off half a day of work, to take their kid to the doctor or get themselves to the doctor, we're coming to them at their home or at their work site. So we got some great clients that signed up right away, which I now realized were false positives, because there are just some people in this world, and there are just some businesses that try new stuff. It doesn't even matter what the thing is. If there's even like a remote chance that it might improve their bottom line or their employees' lives or something, they try it. And we were very fortunate to find about 5 of these employers, like right off the bat. So we kind of had this false sense of security that this was a really good way to distribute the product. But after that first 5, it was impossible to sign up more clients. And some of them were really big clients. Some of them are very prominent clients, businesses that everybody knows. And we realized that it wasn't going to work. And what was happening is all these other employers were like, if you would just accept health insurance, then blah, 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 blah. If you would just kind of work through the claims adjudication system. What about my claims, my claims, my claims? What about my claims? So finally we were just like, okay, we got to accept health insurance. So that's the journey that we started about 6 months ago. And we've done it in a very unique way with Medica and with Blue Cross, in that we're bearing a little bit of risk in our model, but we're not doing it at the patient level, we're doing it at the service level. So it's almost like the services are bundled. I don't know if that makes sense. Instead of going to the doctor and you get your bill and there's like 20 items on there, for the various things they did, we only have 4 codes. And then we bear risk at each of those levels, and it's on us to provide high quality care so the patient comes back, but also not burn through too much cash providing services in excess of whatever that bundled rate is. So it works great for patients because the bill is really simple. It's just one line. For people who are on high deductible plans, it's really great because they don't have to worry if they go in if it's going to be $100 or $500. It's just this price that we tell them. Not only that, the prices on our website are our contracted rates at both insurers. So it doesn't even matter which insurer you're at. The rate is the same. So we're changing all these things, and really all this is connected to my belief around where health insurance needs to go and the role that employers play in health insurance. And just so I can tailor this talk appropriately and make sure I understand who's here, is how many people here are from an employer that offers health insurance? Okay, so Still pretty common practice, to work somewhere where they offer health insurance. Some places cover more than others. Some places have very rich benefits. Some places have very what are called poor benefits or skinny benefits. But I want to stand here and tell you that I believe most likely all the products that you have as your health insurance are wrong. Like, they're actually wrong, and they're part of the problem. They're seriously part of the problem of what is harming healthcare, families, individuals, and this country. But before we get there, we have to put it in perspective. The healthcare industry is $3 trillion. Like, humans don't even have the brain capacity to understand what 3 trillion of anything is. We don't have the capacity to understand what 1 trillion of anything is. Someone might put a really nice picture on the website that says this is 1 million of this, so that you can kind of conceptualize what a million is. But you can't do that with a trillion. Like, the picture wouldn't make any sense. It's like taking a picture of a redwood in Northern California. Like, the picture is quite meaningless, because unless you're there, you don't really understand the magnitude of what it's like to stand next to a 2,000-year-old sequoia. And that's what healthcare is today, $3 trillion. So the best I've come up with how to understand $3 trillion is, suppose we convert all of that into cash money, like 50s, and we burn half of it. Just burn half of it, just for fun. Put gasoline all over those $50 bills and burn $1.5 trillion. You could still fit almost two of our federal government's budget in what's left. Like, that's how big $3 trillion is. How big is it? So the federal budget, like, what does that mean? Like, most people don't know what the federal budget means. But let's talk about the military, because everybody's like, oh, our military is so big, our military spends too much, blah, 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 all this stuff. Well, yeah, our military is big, because the biggest air force in the world is the United States Air Force. The second biggest air force in the world is the Navy's Air Force. No, I'm serious. You can Google it. The third largest air force in the world, maybe the numbers have changed, it's the U.S. Army's Air Force. Like, that's how big our air forces are. So that's how big our military is. So people are complaining about military spending, but military spending, you could have, and you'll have to Google this. The last time I looked at it was, it was a while ago, but you could fit about 5 of our military, like all the branches, 5, and have plenty left over, and that half of that 3 trillion that we didn't burn. Like, 3 trillion is a big number. Like, doesn't really matter how you cut it. And there's no way all of that $3 trillion is being used effectively. It's just not possible to use something that large well. I don't care who's managing it, whether it's for-profit, non-profit, public sector, whatever you want to call it. You can't manage it that well. It's just too big. Like, it's just hands down way too big. And it's not all being spent on medical care. It's just not. There aren't $3 trillion worth of doctors in this country. There's not even $1.5 trillion worth of doctors in this country. There's not $1 trillion worth of doctors in this country. So then you have to ask yourself, what exactly are we spending the $3 trillion on? Yes, there are pharmaceutical drugs that are very expensive. There are implants that are very expensive. It's very expensive and time-consuming to train doctors. But we could stand here till kingdom come. There's no way you'll get to $3 trillion using your rational brain as a way to get there. So what is it being spent on? I put forward it's being spent on administration. It's mismanagement. And I was having a great conversation with my thankfully former colleague, Brian. And I say thankfully because we were colleagues at MNsure. And I had a great time there, but it's probably not something you want to do for more than a couple years straight. And so I give mad props to the people that are still there, especially our former co-board members. I can't remember who got the long straw or the short straw, I should say, with a 4-year term, but someone has to serve 4 years. And, we were just talking before I started talking up here today, and there's kind of 2 approaches to changing healthcare. There's let's focus on the underlying cost structure of healthcare, like what's making it cost so much, and let's make it cost less. Like, forget everything else. Like, even let doctors practice badly. and make all sorts of mistakes. Let's just focus on the cost, and we'll see some meaningful change. And then there's another school of thought where is we need to focus on making, there's lots of ways to describe it. There's certainly managing risk, but in my conversation with Brian, it was more around changing behavior. How do you change people's behavior to use healthcare differently, behave differently, manage their body differently, which could hopefully translate to managing our healthcare dollars in this country better. And I learned something talking to Brian, so I'm softening my stance that I normally take on this issue, because I'm a hardcore focus on the cost. Like, forget all the behavior change, forget all that other crap, forget data, forget value-based payment, forget all that stuff. Let's just make things cost less and stop paying for things that are providing no value. But in my conversation with Brian, I realized that behavior change does work, and it can work. It's just the time horizon is too long for real behavior change. That's my personal belief. So it can happen. I mean, generally, 100 years ago, I think our country was probably a dirtier place because people littered. And now people generally don't litter. People generally used to do all sorts of crazy things. Women couldn't even vote for a while. And that was not even that long ago, quite embarrassingly. So I mean, it takes a while for things to change in a society. And the timeline is just too long because $3 trillion is so big. It's so big that even a 1% growth rate on $1 trillion is catastrophic. And healthcare is growing at much faster than 1%. So you got to remember that base is so big that even a 3-5% growth rate a year can have catastrophic impact on your businesses, your customers, your families, your checking account. So that's why I've always said, that's why I've realized one of the main reasons I've probably had this internal dislike of focusing on behavior change is that it takes too long to get to where we want to get to. And we might not get there before catastrophe strikes. And the only way to prevent catastrophe, and by what I mean by catastrophe, I think catastrophe in this country looks like swift and severe federal government intervention. Like that's what, because the country's not going to implode, but that's what catastrophe looks like in this country. And whenever that happens, unplanned or too quickly or too severely, usually there's negative externalities that the next generation has to deal with. So catastrophe looks like the government having to step in, and that's what will happen if we take too long to fix healthcare in this country. So how do you fix it? If fixing it in the short term, or at least in a meaningful time frame, looks like reducing costs. Let me just make sure I'm not over. All right, I have 4 minutes to fix healthcare. So how do you fix it? Employers, individuals have to try new stuff. Like, that's the simplest way I can say it. Employers and individuals have to try new stuff because this country is really good at creating solutions, and especially in the private sector. And people are working on solutions. I'm working on a solution. And I know 100 other entrepreneurs that are working on solutions, some similar, some different, but everybody has the same goal in mind. And the primary barrier is the slow adoption rate of the people that hold the purse strings. Because we already, as a healthcare entrepreneur, there's already enough negative force and inertia in the healthcare system. I mean, there's entities, there's companies, there's individuals who have a lot to lose if things change. And they're actively, or maybe even unbeknownst to them, indirectly fighting this change that our country so desperately needs. So the solution is just try new stuff. When there's a new company, a new service, a new provider, you get a cold email from someone saying they can help you on your healthcare stuff, just give it a listen. Some of it will be garbage, some of it won't, but you can't tell if you always say no to everything. If you're just too busy to try new things or you don't want to ruffle any feathers, we're not going to change anything. So that's my kind of call to the community, the business community, and to individuals, is when it comes to healthcare, and someone's doing the sales thing to you, just give it a listen, because it might actually be a solution that could grow into something that could have a significant impact on our country. What do I mean by impact? Because just like we talked about, what does $3 trillion mean? Well, think about that. Remember that $1.5 trillion we burned? Like in this crazy bonfire of $50 bills? The total giving, total nonprofit giving in the United States from individuals and corporations is much less than $1.5 trillion. Much less. So just imagine tripling nonprofit giving in this country without raising taxes, without any drastic changes to consumption, without reducing discretionary income, by removing a lot of non-value added services in healthcare, and by reducing the actual unit cost of healthcare, we could literally triple giving in this country. And by doing that, we would eradicate a whole host of systemic societal problems in our country that would actually compound the positive benefit of changing healthcare. So the actual benefit would be much greater than 1.5% of $1.5 trillion. This is how I think. This is what I eat, I sleep. I mean, this is all I think about, all the time. You can talk to my wife, you can talk to my son. I mean, my son knows who the names of the healthcare systems are in the Twin Cities. Like, he knows their names, and he knows what to say after he says their names, I mean, it's just real. I mean, this is effective. I can feel it crushing me. Like, every day I wake up, I can literally feel the healthcare system crushing my dreams, your dreams of so many people. Everybody's talking about all these problems that we have. Everybody's talking about race relations, about politics, about energy, about the environment, about global warming, about food, about nutrition, about hunger, about cold, about heat. Like, everybody's talking about all this stuff, but none of that actually matters as long as you have this $3 trillion thing. Like, we could solve every other problem that we have in this country, and the fact that 19% of our GDP is being consumed unnecessarily by healthcare will actually not allow us to accrue the benefits of solving every single societal problem in this country. I firmly believe that, because money is money, cash is king, and certainly $3 trillion is king. So that's my solution, and I encourage you to try new stuff, and especially try RetraceHealth if you get an email from me. Thanks.